The U.S. Food and Drug Administration has granted Florida permission to import certain medications from Canada. As Kate McKenna tells us, the approval comes with big implications here at home.
We expect that this decision is going to reignite some concerns over drug supply here in Canada. So the FDA says it's willing to potentially allow Florida to import millions of dollars in prescription drugs from Canada, including drugs that would treat HIV/AIDS, diabetes, hepatitis C. A letter from the FDA says that importing Canadian drugs could save big money for Florida without compromising the health of Americans. Florida thinks that it can save $150 million American annually with this plan. And what's really at issue here is that Canadian drugs are cheaper because Canada negotiates directly with different drug companies to get a lower price, whereas drug costs in the States are quite high, and this has been a political issue over and over again in the United States. However, this is just one of several states. Florida is just one of several states that's made this application to the FDA asking to import Canadian drugs. So this could be a precedent-setting decision. In the past, Canada has said that this is not going to solve the American problem. This is not the first time the United States has looked to Canada for cheaper drugs. But in the past, Health Canada has said that the Canadian supply simply isn't enough to be able to lower drug prices in the United States as well. And as I mentioned, this isn't the first time the United States has looked to Canada. Another instance of that was in 2019 when the then Trump administration sort of floated importing drugs from Canada as a way to lower prices. At the time, Canada did respond to that. The country said that implemented new rules where drugs that are in short supply cannot be exported to the United States. And there are some additional kind of administrative things that have to happen before Canada can export drugs to the United States. For instance, Florida has to send a list of drugs that it wants to the FDA. They also have to relabel all of those drugs with FDA approval. So this isn't something that's going to happen overnight, but we are expecting a Canadian reaction to this in the coming hours. Kate McKenna, CBC News, Ottawa.